Concerns are mounting that bulk billing could no longer apply for pathology tests as rebate freezes loom on the horizon for testing companies. AMA WA President Dr Michael Page joins us to unpack this issue. Thanks for coming in, Michael.
Good afternoon, Monica.
An ad campaign has been launched across GP clinics, TV and also radio. What do patients need to know?
Well, when you go to your doctor and your doctor asks you to go and have a blood test and you go and get that blood test done with a pathology provider, usually you won't receive a bill for that testing because most pathology testing in Australia has been bulk billed for a very long time. Now, the trouble is the Medicare rebates that enable that bulk billing have been stagnant for an extraordinary length of time, about 25 years. Now, the pathology industry has managed to survive for that time through improved efficiency, automation and consolidation of the industry, but it's really at the limits of the efficiency that it can achieve, and so those rebates are really no longer sufficient for it to keep doing what it's doing, in other words, bulk billing patients as a general rule.
What will the impact be if this changes?
Well, what we're really concerned about is if pathology companies need to start charging patients a gap fee for testing, which is of course what we're concerned about here, that some patients will choose not to have testing done, and that would be a terrible outcome because of course if you don't get your test done and a diagnosis is missed or delayed, the cost to the health system further down the line will be extraordinary, and of course the impact on that patient.
Pathology providers claim that they can't continue without raising costs, so what is the solution then?
Well, there's really only one of two things that can happen here, Monica. One is that the federal government addresses the issue and provides proper indexation of Medicare funding to pathology testing, or the pathology companies will have to find a way to cover that gap by introducing fees to patients.
What impact will Australia's growing population have on pathology clinics?
Well, I think we have not just a growing population, but one that is increasing in age and increasing in complexity, and that is, of course, putting huge pressure on our health system. And if the federal government doesn't address the sort of crisis of funding that so many parts of our health sector are facing at the moment, we won't be able to continue to enjoy the high standard of healthcare that Australians currently enjoy and deserve.
AMA WA President Dr Michael Page, thank you for explaining.
Anytime.